A top doctor says the COVID crisis in Victorian hospitals is under control, with infections falling for a third straight day. Data shows unvaccinated patients account for all virus admissions to ICU. Medical reporter Emily Rice has this exclusive report.
There are still more than a dozen patients in the Royal Melbourne Hospital's COVID intensive care unit.
Patients are critically ill and they're on life support.
In the main, those who are unvaccinated become the most sick. When their lungs fail, they are placed in an induced coma and on a ventilator.
Put a breathing tube in through their mouth, through the voice box into their lungs and take over their breathing.
Despite the sad scenes inside the Royal Melbourne, Director of ICU Chris McIsaac says the number of coronavirus admissions is falling. He is also hopeful Victoria's COVID hospitalisation rate has peaked.
Right now I describe the situation as under control. We're optimistic that it's going to remain under control.
New Department of Health figures show all of those with COVID in ICU are unvaccinated.
The evidence is overwhelming that vaccination prevents you from getting sick.
There have been 797 new infections, the first time the tally has dropped under 800 since September. 394 coronavirus patients are in hospital, 72 in ICU, and there have been 8 more COVID deaths. While Melburnians are enjoying getting out and about, doctors say it's crucial that we continue to follow COVID-safe protocols to keep the virus under control, like getting tested when we feel sick and being fully immunised. In the past couple of weeks, the active caseload in Victoria has dropped by about 5,000 cases, now sitting just above 14,000. And those feeling fatigued on the front line have their fingers crossed for better times ahead.
But I am optimistic that with numbers falling, staff will be able to have a break. I'm hoping to have a break too, and I think that we will be able to get through this okay.
Emily Rice, 9 News.
2 months after an earthquake gave it an almighty